Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, today's episode, we're going to make you think, what if adding years to your life was actually possible, and not just years, but healthy, active years? My guest today, Dr. Stephan Goupil, is going to show you exactly how he's doing that with his patients. But before we dive into that, just a quick message from our sponsor, Grow Solutions, where we help health and wellness professionals reclaim their evenings and weekends while building the practice they've always envisioned. We try to eliminate headaches of generating new clients or patients for you. If you've got communication breakdowns, operational chaos using proven systems and frameworks that we install. And yes, we absolutely help you install some AI agents because the future is coming, whether you like it or not. So Grow Solutions is not an agency or a vendor. We are your growth partner. So if you've ever said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word grow below. One of my staff members might reach out to you or myself, or reach out to me on any social platform. But you came here today to be introduced to an amazing physician that's out there doing things. Okay, so you came here for the purpose of being introduced to our amazing guest, Dr. Stephan Goupil. Dr. Goupil, please tell us about yourself and what you're doing right now in your practice.
Awesome. Well, first off, Dr. Barron, thank you so much for having me on the podcast today. As I've told you before, I could go on and on about myself, so I'll keep it short because I know you want to talk about my practice and what I'm doing. Looking at where I am now and where I came from, I am double board certified, DO, PhD. So I'm board certified in family medicine and lifestyle medicine. I currently am running my own lifestyle and longevity medicine concierge solo practice that I opened up just a year ago. And I actually became a physician as a second career. So before that, I was a biology professor. I worked in biotech and I studied the genetics of aging. Before that, I was an undergraduate philosophy major. So I've had one of those twisty, windy paths that brings me to a space where I think I'm perfectly set up to work with my patients to create personal health plans and do that as a collaborator and an educator, if that makes sense.
Yeah. Absolutely. That's very interesting. The philosophy background is always unique. And I think that gives an individual so much more empathy. It doesn't take away from somebody that hasn't been in that, but having the philosophy background really makes you become a thinker, and not a thinker for yourself, but for the case of the patient that you're working with as well.
Absolutely. I always say, like, starting with that philosophy degree, my science degree, and then medicine, I've just been trained in critical thinking for like the last 30 years with a heavy science and clinical background that I'm now bringing to my patients. And as we'll probably get to at some point today, a crash course in the last 6 months on how do you run your own business and create your own business that they didn't train you for in any of those previous degrees.
It's because they didn't want you to go into their own practice. They just wanted you to stay in the hospital or the clinical setting. But I think you're making the right move for sure. So Dr. Goupil, I want to ask, I know you've kind of had these three avenues of what you go into it, but what was the moment or what was the reason, the life circumstance that actually had you choose your career in medicine?
So I think it was always kind of sitting there in the background, actually, being like a lifelong student coming out of that philosophy degree. I was like, what the heck am I going to do with this? How can I keep going to school? And so I was like, either do a PhD or go to medical school. And at the time, the PhD research path just presented itself more. But always when I was working in that aging lab, and that was like 25 years ago, like it just wasn't the perfect fit for me. I was doing bench research. We doubled the lifespan of a fruit fly, but I was always thinking, what could we do to apply this clinically? Like I was thinking futuristic sci-fi longevity medicine. And then 25 years on that crooked path that I took after I get done with residency, after I got done being somewhat unhappy with how medicine is practiced in the hospital setting, I find myself perfectly ready to catch that wave where longevity medicine is actually like in like a practical sense coming to fruition and being seen in the clinic, if only on the cutting edge, but at least clinically and not just basic research. So my arch through that whole path always was, when I did come back to medicine, was that genetic background and personalized medicine and precision medicine. And so I thought I was going to actually go on and do a medical genetics fellowship after I got done with residency. But as we all know, residency is something we wouldn't wish on our worst enemy. And so I realized I was done. I could do what I want as a primary care doctor. I had found a passion for it. I had found a passion for listening to my patients. I found that most of their problems were either related to mild to moderate mental health stuff, anxiety, stress, depression, or the big one, which eventually led to my second board certification in lifestyle medicine, was I saw like the underlying threads in chronic disease being related to poor lifestyle choices. And so I kind of practiced that on my own. I had been inspired by like the mind-body connection and stress management very early on. Actually, it was a GI doctor in medical school that taught me about the mind-body connection. And so I was applying that for quite some time with my patients, spending longer than the hospital wanted me to in those preventative visits, and then slowly learned more and more about lifestyle medicine, and then jumped on board that train, and it's led me to where I am today, I think.
Yeah. So it's interesting. You hit on probably almost always the number one concern of the patient looking at the physician or the practice, and then those that make that transition from typical medical primary care into lifestyle medicine, and it's the time with the patient. 7 minutes, 12 minutes just doesn't do it unless it's a sliver. You know, there's not much else that you can handle in that point in time that's fair to the patient. The hospital and the powers that be above there, from the ones that are driving the income, if you wish, don't necessarily care. But it's hard on you as a physician saying, I know there's more to this patient, but I've got to go to the next room.
Yeah. And I was lucky. I mean, wow, those times are crazy to me. I think I would have been a lot burnt out a lot sooner if they were pushing me to the 7 and 12-minute ones. I was actually lucky. I had 2 hospital employed positions, 2 primary care clinics that I worked in over 7 years in my career before I came to where I am today. And both of those at least like dangled the carrot in front of me of allowing me to spend time with my patients and do what I want. In the first one, though, after that first year, there was the pressure from administration. We were seeing patients for their preventative visits for 45 minutes, which is wow, an immense amount of time, 30-minute follow-ups. But that only lasted so long before the numbers started to creep in, and they're like, you need to be seeing more patients. Then I was recruited after the pandemic, after that practice shut down, to another practice that I think was amazing and is great for my local area. There's still a primary care clinic here. They again allowed me 45-minute physicals, whatever I wanted for follow-up. So I was doing my own thing, and it was one of those ones where we had like a broad range of physicians, which I think was nice. Like we were all doing adult care at that point, primary care, but we had a DO that was actually practicing osteopathic manipulative medicine, which, if you know it all, is like a needle in a haystack kind of thing. Yes. And then at the other end, that was the assistant director. And then the medical director was one of those old school guys who used to round in the hospital. So, and everything in between. So they allowed me to do what I want. But again, like you were on fixed paid for the first 2 years, and then they started to look at the numbers, and they were like, you can keep doing what you're doing and you're going to earn less money, or you need to start seeing more patients. And I mean, I've always said, like, I did this as a second career. I wanted work-life balance. I wanted to help people. I did not want to be burnt out. I did not want to be one of the doctors that I shadowed, like an OBGYN who was telling me she wanted to quit medicine and be a grocery store clerk, or a primary care doctor that I shadowed with before I went to medical school that said he wanted to quit medicine and become a DJ. I did not want to have one of these like bizarre burnout stories.
Yeah.
I wanted balance. And so had always worked part-time. And I even, when I got to that point where we were going to have to make that decision, I was like, I value my patients over money. I've always said any physician shouldn't be complaining about money, even on the low end of us as pediatricians or primary care doctors. We still make a better income than the large majority of people out there. And it's really our own doing when we burn ourselves out or we let people burn us out, kind of thing. So yeah, then a unique, I had always had in the back of my mind kind of this vision of like, well, when is this not going to work, kind of thing, and when am I going to have to do my own thing? But it was this huge chasm from how do you go from just jumping to another paid position where they give you 2 years of doing what you want to creating your own thing. And even though if you look back at my past and you asked how did I get where I am one of those ones that jumps into like the exciting thing, the new thing. I don't think I do it completely blindly, but I often look at what is on the other side of that fence, kind of thing. Yeah. And a unique position opened up that you don't see very often. I actually had the opportunity to shadow with. There was a functional medicine concierge practice that was looking for physicians right when I was at that cusp of that 2-year mark with my last primary care position. I said, what the heck, man? I had always kind of, as lifestyle medicine, I kind of had a lot of overlap that I loved with functional medicine, but a couple things that I always was kind of skeptical of. As I said, like the scientist in me, the philosopher in me is always looking to pick and tease apart and be a critic about things. And there were a couple things that I always kind of kept at arm's length with functional medicine. And I said, unless you let them show you what they do, you're never going to know, kind of thing. And so that's where I took a leap, and they brought me on. And I call it a shadowing because it was pretty clear after a couple months, like it was amazing. I mean, the embracing of lifestyle medicine that I think functional medicine does is just amazing. And it's where tons of their success comes from. And I think is really groundbreaking. But there is different philosophical bents between them and me. And so they actually helped advise me on when I left, because I was like, well, what do I do? Just crawl back to primary care? And they're like, no, you should do your own thing. We think you would be great at it. And so they kind of helped me with some of those first big decisions in how would you start your own practice, kind of thing.
Yeah. So that took you into saying, okay, I'm going to take the leap of faith and I'm going to open up extended Healthspans.
Yep.
So tell us about that practice and basically, I guess, your practice philosophy behind it.
Yeah. So my practice philosophy, well, first off, it was, I loved the idea of longevity medicine and being able to get back into that a little bit. But in my practice philosophy, I say like functional medicine, supplements, longevity medicine, that's really the icing on the cake on what I think is an evidence-based, proven sort of method that I apply in my clinic. But before we get to that, I think the name, which I had been kicking around long before that, and my daughter, at one of the first things we did was she helped me with the logo, and I still have those initial pictures, kind of thing, before we professionalized them as I was opening the business, kind of thing. And so like I wanted to focus on, and I'm sure this is a thing that you've heard over and over again, we're not just looking to, like I was with the fruit fly, I'm not looking to double the lifespan of my patients, kind of thing. I do truly think we will see some people and some of these longevity practices and some of these protocols really start to edge out like and increase lifespan. But for the large majority of people, I think the low-hanging fruit is extending that health span or the years in it. And I mean, the functional practice I was at, I don't think that they had copyright on this. Everyone is always saying, hey, we can make you live to 100, but what is it going to be like in those last 30 years? And so we want to bring health to that. And so that's where the idea of extended health spans came from. The philosophy of my practice, again, is based on listening to the patient, meeting them where they're at, personalizing their plan, it being evidence-based. But the sort of that foundation I focus on is, I think it's really key to be focusing on preventative medicine, like making sure they understand evidence-based treatments, options, vaccinations, cancer screenings, all the things that their primary care doctor is doing and trying to do, and just doesn't sometimes have enough time to tell them all the options. From there, I say, then what I'm doing in my practice is helping them prevent, treat, and reverse mild to moderate chronic disease. So I do feel like I'm carving out a little bit of the primary care and not wanting to do that. I say I'm part of a greater team. I hope you have a halfway decent primary care doctor that we can leverage when we need specialists. I know a lot of them from my background in this, and you want to bring a specialist in when your disease is moderate to severe kind of thing. But really helping them optimize that. And then the first line is, again, lifestyle medicine. I mean, if you're not familiar with it, like the 6 pillars of lifestyle medicine: diet, exercise, minimize tobacco, alcohol, and drugs, stress management, get good sleep, and healthy social interactions. This is why I love being board certified in lifestyle medicine. I think they really dug their heels in and said, we want this to be evidence-based, and we keep researching it and reproving it and fine-tuning it, kind of thing. So that's sort of my first line treatment, which often fits well with patients, because for whatever reason, many patients are very averse to, like, just give me a pill kind of thing. But then from there I say, hey, I'm still traditional trained, like medicine and science works. Like, we've got to think about those and when we would engage those in your personalized plan. One of the really exciting things that gets me passionate about what I'm doing at Lifestyle Medicine is the next tier of it, and that's advanced labs. And so this, I say, kind of falls into 2 categories, at least in my mind. There's advanced labs that have been proven for like decades, and it just takes a long time for that stuff to trickle down to primary care. We're seeing it happen now. I'm sure you've heard about them. Things like LP little a, ApoB, like labs that help us better risk stratify cardiovascular disease than just using those old terms of like good cholesterol and bad cholesterol. Fine tuning like our diabetes screening or insulin sensitivity and metabolic stuff. And so I kind of put that into, like, that's my comfort zone. That's ordering labs from Quest. That's labs that oftentimes insurance will cover. Usually a lot more so than when you get to Medicare and they really kind of like put their thumb on the scale kind of thing. But these are things that fit with both patients and myself. But then there's another kind of category of labs that I kind of throw around the term, and I say, I call them functional medicine labs. Basically what I'm saying is labs that oftentimes aren't covered by insurance kind of thing. And there's a large breadth of things in there that I'm happy to talk about and work with my patients, but I tell them these are things that are going to be coming out of your pocket or out of your FSA, HSA account. But I think they're very much useful to it. I mean, we talked about LP little a and ApoB. The things I focus on are what are the chronic diseases that are going to kill you. And so cardiovascular disease is just where I'm kind of like a pig in slop. Like, I love dealing with that because it's the major #1 killer. And so using these labs to personalize these plans and personalized risk stratification is really great. Next level is cancer screening. And so again, that goes back to the prevention stuff. And again, talking to patients, and it just blows my mind sometimes that their PCP has only talked to them about a colonoscopy. And when they're not getting that, like, the conversation just stalls there because there's not enough time to talk about the 12 other options that they could do. And very easily, Cologuard should be talked about in that regard. You should not be not getting cancer screened just because you don't choose one of these kind of things. Why I brought that up is there's those known players for some of the cancers: breast cancer, cervical cancer, prostate cancer, colon cancer, like we were talking about. But there's some really cool tests on the market now that are doing like cutting edge science to look at like small fragments of DNA, and they're picking up like dozens and dozens of more cancers that we don't even have screening for, like pancreatic cancer, and also picking up these cancers at a much earlier stage. What's really exciting about that is some of those guys are being picked up by insurances now. And so I think we're going to see, well, a couple things. I am starting to see a push from what we would call our customers or our patients or clients, like empowering themselves, which I've always been a big advocate for my patients, particularly when they have those time crunches of only 7 minutes. You've got to advocate for what your needs are with your doctors, kind of thing. And so they're advocating to be tested for LP little a or ApoB. And some of these insurances, I think, in the near future are going to be doing some of these blood screening tests, because I think the data just supports it. As I said, from there, when it gets to more severe disease, I bring on recommendations for specialists, and I say that's the foundation, but we can play on top of that with things like supplements and longevity and functional medicine. But I always say it's not those supplements that are gonna change like your bad lifestyle habits or like your underlying chronic disease kind of thing. They're really for optimizing after we've got a strong foundation kind of thing, if that makes sense.
It does. So that's Dr. Gopal, that's your philosophy for how you practice at Extended Health Spans. I guess my question for you next is,
Yeah.
what are the common conditions that you see approaching you in your practice?
Yeah. I mean, I feel like it's just primary care 2.0 kind of thing, and I'm trying to carve out that acute thing. I mean, I still see a broad swath of patients, from those that I love. I mean, I'm always passionate about like people that are trying to prevent. So someone that is either just seeing the first signs of chronic disease, or they're recognizing, hey, I'm not immortal, and these are the things I want to start worrying about, heart disease or metabolic disease, before it happens. So I mean, that's one of my favorites. Unfortunately, many of us, it takes some sort of wake up call. So a lot of my patients I see either have been told or are starting to be told that they have high blood pressure, diabetes, pre-diabetes, overweight, obesity kind of thing. I mean, the guys that I used to use, I had this paper up on the wall, because I think humor is an important part of medicine. And you see, like, you got to bear with me a little bit. And my patients kind of knew my humor and stuff, so they would get this. But in our preventative primary care visits, I would turn to the CDC's top 10 reasons that adults die for. And I'd be like, it's time for us to look at the wall of death and kind of think about this kind of thing. And again, that's what we were kind of hinting at. And that's what I see: heart disease, cancer screening, metabolic disease, neurodegenerative disease. And so those are the things that I'm dealing with and seeing in my patients. I'm always hoping I see them before they're a problem, or when they're early stage, or again, when they're mild to moderate. But I even have patients that have come to me in probably, I say, okay, it's still moderate, but in all essence, it's more severe cardiovascular disease, because they've already been engaged with a cardiologist, but they're bringing me on board to kind of do that deeper dive and to help them, because they know that I spend a lot more time with them, and I can help them so that they can advocate when they're with their primary care doctor or when they're with these specialists. So I hope that answered most of the questions. Was there any other parts of that were missing? I don't, one thing I do want to throw in, I have a mixed feeling about this. I guess I can love it and be fearful of it, because I don't have too many of these patients yet. But even the idea, because I think it's a small percentage of the patients out there, but again, calling myself a longevity doctor as well, I mean, it would be interesting to have some of these patients that are really truly digging into that longevity medicine or doing biohacking and stuff like that. And I think I'm someone that can help collaborate with them, definitely a lot better than their primary care doctor probably could. Where I get a little fearful is that these guys probably will come to me knowing a lot more than I know, kind of thing. And so you feel like, what am I bringing to the table? But again, what you're bringing is a sounding board and someone with a different perspective that can help them validate or critically analyze the things that they're trying to do. Because again, with longevity medicine, you always are on that cutting edge where it's not like we have 20 years of clinical experience and tests in humans that this is going to make you live longer or twice as long. That's not happening anytime soon. And so they're making their decisions based on, unfortunately, what someone's selling or what someone is pushing on their Instagram account, or at best, and I think they are doing this with their due diligence and looking at basic research and being like, well, this is seen in mouse studies or dog studies. But as I know, as a scientist, science is hard, and making those jumps from like models to what this will mean in a human are also have a certain amount of leap of faith to it, kind of thing.
Yeah. Yeah. I love that approach. It's very interesting. Now, a unique perspective is you've been in practice for a long time in different settings. You started your own practice. So from the business standpoint, what is your focus on right now in your business?
Yeah, I mean, can you define that a little bit more? Like,
So if you look at your business, you've been into it for your extended Healthspans, you've been into it for a year. What is your focus? Is it growing? Is it attracting?
Okay, I got it. Yeah. No, the way I'm going to see it is actually what I'm working with a lot of people, actually like yourself, I think, and your sponsors and stuff, because I've recognized I've been very lucky. I mean, I was on another podcast where they're like, well, what do you do as a small business owner, like when you haven't had this training? I'm like, you apply the 30 years of training that you have as a lifelong learner to now I'm going to learn about something else. And it's a crash course, and you're going to make errors. And you got to know also the other thing that we know as physicians is we don't know everything. So you've got to find people to help you, kind of thing. So I think I was very fortunate in how I structured the company and who I worked with. But I definitely have hit the pain point that I think is not uncommon in businesses like my own. So I am a sole practice too. It's just me. I kind of optimized it for that. Went through different pain points. One of the big ones being like, well, what is the right electronic medical record system? But the one I'm at really now, to get back to your question, is I'm really in a phase where I know I have a good product. I know that I'm in a good area where people could connect with that product. I mean, I see the health industry, and so it's connecting. I have some patients, but it's getting that growth that I need. So my pain point right now is really marketing. And so I've tried a couple different things. I'm always still trying new things. I do know the boots on the ground like works great. I mean, that is where my success is working locally and working in the local community. I'm part of like my town's elected board of health, which makes me more visible. I work on nonprofits. I have one of my own local chapters of Walk with a Doc, which is an international nonprofit. I was recruited recently by another member in town to help with a nonprofit from that's based out of the UK called Park Run, which all support like physical activity and healthy social interaction. But the big thing that I think is helpful, other than doing that local business to business and meeting with your other health and wellness people out there so they know you and you can kind of cross promote each other. But I think what works really well for me, and I pull from that time that I was a biology professor and how I can prattle on and on about the things I'm passionate about, is a while ago I created kind of an intro to what is lifestyle medicine kind of thing. And so I have this 40-minute talk that I can just kind of give anywhere that they're willing to let me give it. And so I've given it at some local businesses. I've given it at senior centers, at community centers, just anything like that. And I think it's been really successful. I've done it over the last year just locally in my town. And again, part of being a small business owner is you got to motivate through that procrastination. And so I know that I now have to do that in the surrounding towns kind of thing. But I also know, like, again, I'm always looking for what else can I be doing in marketing, because I do think we live in a digital world, and anything I've done in that realm has just been kind of like throwing money or throwing time into like this black box that I feel has like a black hole in it kind of thing. But I have worked with people and interns and stuff to try and do some things about it, but haven't found that magic bullet yet.
Well, if I could give a suggestion, don't look for the magic bullet. Because somebody's always out selling the magic bullet, and it works for one purpose, to just be shot and be paid for. So be careful. And I completely understand the easy button, the magic bullet are things that we would all like, but I don't think they're very. I think they're more detrimental than good to all of us. So
Yeah,
yeah, go ahead, Doc.
I think that's a good point, and I used it probably as a turn of phrase too easily.
Yeah.
Like, more so, I think I'm looking for like help with that expertise kind of thing, and someone, again, like how I bring health and science to my patients, like working with someone that's not trying to sell that magic bullet, but someone that does have experience with marketing, particularly as we learned, again, with the intern I worked with, who was really, really great, but was new to his field. We learned very quickly that actually Google Ads like handicaps medical providers in being able to target people that are looking for help with chronic disease, because they feel like that I'm using the wrong word, but stigmatizes those people. And so he was like, I can do general marketing, but like if someone's looking for like problems with obesity or problems with hypertension, like Google kind of like would put a cap on him. So again, someone that has worked in that field and knows how to massage it or work around it. Again, as a small business owner with a tight budget too, it's tricky sometimes because you get what you pay for kind of thing. But you also don't want to get sold a magic bullet and waste that money when you could better invest it in solid marketing kind of thing. So that's where I'm at. Sorry to prattle on about marketing,
No.
but it is absolutely my pain point right now.
Yeah. I completely understand. I have been there in multiple different businesses, practice, and in my own business that I'm in. It's hard. It's great. Nobody likes to admit that there's a problem, but you also have to find out what the problem is in order to make it better. So I want to jump back into your practice.
Yeah.
I'd love for you to share a success story of a patient that's come to see you from the lifestyle medicine component, and how you've made that change in their life.
Yeah, I'm going to cheat a little bit because my practice is new. It's small. I've got just a handful of kind of patients, so I don't think I have the success stories yet with these particular patients. Because again, while the doors have been open for a year, I really haven't. I've only started seeing patients for 9 months. Like most of my patients have only been seeing for 3 to 6 months. So I think there has been success in I'm engaging them with evidence-based lifestyle kind of components, but I go back to this stuff does work once we give it time, and it's just early. And that's the other thing. It's very early for these patients. They've either engaged in it already if we're having some success, but the ones that really are coming to me with problems, it's going to take 6-12 months investing in this stuff to come back and tell you, hey, here's this guy that this happened to, or here's this woman. But what I can do is say, I can look back on when I was practicing this same model in my primary care setting. I can say, well, it's a small number. I mean, I told you I was part-time, so my patient panel was definitely small compared to some of those other PCPs out there that it's crazy that they have several thousand patients. I was seeing 600 patients working half-time kind of thing. But I would reach back when I would spend a lot of time with my patients, looking at that wall of death, talking about preventative medicine. I'm like, this does work. One, though, it takes engagement. And if you look at the lifestyle medicine studies, oftentimes a lot of these that really move the needle are intensive changes to those 6 pillars kind of thing. But what I would say because I mean, I was a rah. Like I would help engage my patients, and those that went with that and heavily engaged with it, I had more than a half dozen success stories where I did have patients that we either got them off of their blood pressure medications. Again, we're talking someone that was early stage, mild hypertension where we had just started blood pressure medicines or they had just come to me on blood pressure medicines, but aggressive lifestyle interventions after 6 months or so, and we were able to get them off that medication, and their blood pressures were good. Or the other success story is always too, like reducing the dosage of the medication of that metformin or that blood pressure medicine or that statin, because believe me, I had well more than a dozen patients that were always like, after we had started on the medication, they're like, my blood pressure looks great, when can we stop the medication? I'm like, well, right now, if we stop the medication, I can guarantee you, like, your blood pressure is going to go back up, kind of thing. We need like more of a buffer, and we need the time to get that like driven down because these medications work. So even those small success stories where we would see where I had patients that we were able to get them off of a second blood pressure medicine and only on one, or get them on a very low dose or a lower dose of that statin. I did truly have like a half dozen patients that did that. At the same time, I absolutely saw the common thread in that was these patients engaged in the lifestyle changes and recognizing that like they needed to, as I said, not just be an advocate for their health to their healthcare team, but they needed to be going home and promoting those things and advocating for achieving those things. So
Very good. Yeah, I love it. And you will, with your passion and your drive, Dr. Gopal, you will have those patient successes in no time flat. I'm sure, even the ones that you're working with. So that's a good situation. I know
yeah.
you've only been in this current practice, extended health spans for a year. What's the vision that you see in your practice over the next 3 to 5 years?
Yeah, so I mean, there's two visions, particularly as I work with like vetting marketing teams, vetting these business coaches that promise like a magic bullet to make you a seven-figure kind of practice kind of thing. But I think I have two visions, like, and I think you always have to have two visions. Like, one is the realistic vision of like what would make me happy and what would allow me to help 100 patients or so and still have my personal well-being and health and balance and work-life balance with my family. And so where I would like to see extended health spans, actually hopefully sooner than 3 to 5 years, but I could see myself running this as like one of those, they call them either like a micro practice or a boutique practice where it is truly just me and I don't have to manage running staff or anything like that, because we're in an age where AI and EMRs can help you, and my patients can schedule their visits, and the EMR can help us a lot. And as I start to try and adopt AI to help me with writing notes and stuff like that, I think you can have one of these small sort of practices. And so I would like to see something like that with like 100, 150 patients kind of thing, that I am working part-time kind of thing, and seeing great results with these patients. At the other end of that, like, I think you always have to have that vision of like, but where else could it go kind of thing, and like what is like running that marathon in under like 2.5 hours kind of thing. And so I mean, if it's successful, if everything is balanced, if I want to take it to that next level, like, you grow that practice and you find staff and you take on another provider, and then you grow it to something that sees more than 250 patients. And I think even that can easily be done. It's whether I decide that I want to shift that focus to business or whether I just want to stay doing the clinical kind of stuff. But I always have in the back of my head of like, who are those people that I worked with? Who's that doctor that I know aligns with me that I would bring on, that would continue this sort of vision. But I do think you could scale in that capacity kind of thing if you wanted to. So I see a couple different outcomes that I would see as being success stories.
Well, the good thing is that you have a vision. There's some that don't from the true business perspective, and you want two things. You'll take one or you'll take both. But I think from what I've heard from you so far, that lifestyle and family is very important, and you can have that, and you can have your 100 or 150 patient panel that's there, give them great care, better than they get at their primary care physician or anybody else that they see. You can still enjoy your time, your family, and it's a win-win for everybody in that regard. So, Dr. Goupil, I'll share all of your links and content as we go through this, but if someone is interested in what you're doing and they're in your local community, or doesn't matter because you do telemedicine, I'm sure as well. So how would you like them to get a hold of you?
Yeah, so I mean, I would say for anyone, the best place to connect is go to my website, look, learn more about me. So www.extendedhealthspans.com, which I'm hoping you'll put up later, kind of
Yes,
thing.
sir.
And they can connect with me there. My contact information is there for the clinic, my email address. So feel free to email me, Dr. Goupil at extendedhealthspans.com. There's a way to connect with inquiries through the website and send messages. I also offer free 15-minute sort of meet and greet telehealth. So that's really great. Yes, while I do telehealth, and we didn't talk about this, my practice being a hybrid practice, so I do see patients in person as well as doing a lot of telehealth stuff. I am unfortunately right now pigeonholed in the regard of I am board certified and licensed in Massachusetts. So I know your podcast goes much broader than that. I am very happy to hear from people outside of Massachusetts, but really to practice with someone in my capacity right now, because I am practicing as a physician, they would have to be really, for us to get the best out of it, it would be someone in Massachusetts, but it could be in someone in Massachusetts that's 2 hours away. So that geographic restraint isn't there. I don't know. That's another growth thing that I think about is, do I do a little bit of a pivot and do more of the coaching, and then that opens it up that if I get enough people that are showing interest outside of Massachusetts, that you pivot that business model. That's the other exciting thing about me being in control and it being small. And I'm already seeing where we're doing pivoting stuff, because one of the things that I applied to the practice is, it is, again, I am private pay. So the big kind of way that I practice medicine right now is advocating for my membership model kind of thing. And all of that stuff is right there on my website. But as I learn more about business, I recognize that there can be success. And I've even seen with some of my patients where they need more time and they may need more stuff rolled up into this, that I may also adopt things like more intensive program-based things to help kickstart you when disease is more advanced or when you need more help with kind of those things. So a lot of different things. Did that answer your question, or did I get off on a tangent?
No, it's not a tangent. It's what's going through your brains. You did hit it on the head. So we've got two final questions here as we wrap up. You being in lifestyle medicine and what you've done in all your practice and with your philosophy background, if there's one piece of health advice you could give our listeners and viewers, what would that be to live a better overall health?
I mean, it is that there is no ever one thing or one magic bullet, as a great doctor told me earlier in this podcast, kind of thing. But a couple of them, I do think. I mean, I think it's always recognizing that you as the patient are going to have to engage in this to be successful. Even if you're just adopting traditional medicine, like, you've got to be taking your medications, you've got to be following up in your visits, kind of thing. But getting it back to one thing, I mean, I just love and am passionate about lifestyle medicine. I think it's evidence-based. I think it answers a lot of the chronic disease stuff. It's applicable to mental health, mild to moderate mental health disease. So all the stuff that you see in primary care, and that I talk about when I do my lifestyle medicine talk, which hits on one of the things that, like, this country spends over $4 trillion on healthcare, and 90% of that is actually to chronic disease and mental health disease. And lifestyle interventions are a treatment for that kind of thing. So it's a low hanging fruit. It's a low cost fruit. But it does take time. And it does also take a paradigm shift kind of thing. So it's not just giving the physicians more time to do it. It's that, I mean, we joke, like when I tell my patients diet, and I don't mean that as like a fad diet, like what you eat is important. One of their first questions is, okay, let's break this down. Like, give me the details, because the devil's always in the details. And I'm like, well, in my 30 years of training and those thousands of hours in medical school, we spent like a couple on nutrition kind of thing. So it is really cool to see that lifestyle medicine is making inroads into primary care. And more importantly, it's making inroads into medical schools so that the future doctors will be trained in that kind of thing. Then the other thing, the last thing, I'll let you turn it back to your next question, but I'd say find someone, a healthcare provider that is evidence-based, that you trust, that can help you make these decisions. Like me, for example, self-plugging promotion. But I mean, as you pointed out, there's just there's so much information and misinformation out there kind of thing. That's what always sort of worries me, is when I see patients looking for magic bullets or coming to me with like, well, I saw on Instagram that this supplement's going to cure everything kind of thing. You got to have something to temper that. And I think it's someone that has a grounding in science and traditional medicine, but is also open to hear you and what your needs are. Again, that it's personalized to the individual kind of thing.
Yeah, no, I love it. It's very good to have personalized, and you hit it again. It's listening to the patient. The patient will tell you what they need if you have the time to listen to it. So the last question is, as we wrap up, Dr. Goupil. So since you're on the Prime Health podcast, I always ask this. Everybody's definition is unique to themselves, but what would you say your definition of Prime Health would be?
I mean, I'm going to cheat, I think, and maybe save you on a little bit of time. But like, I mean, Prime Health, I think, really is focusing on lifestyle choices. I mean, if we focused on eating a healthy diet, moving and exercising more, stress reduction, I mean, I think is just a big one that people recognize but have a hard time engaging with it. And then that leads to getting better sleep, which we see more and more is really important. Low hanging fruit with lifestyle medicine pillar of saying toxins are a problem. Like, I'm not going into the deep end of like all the toxins functional medicine loves to look into. And I'm not negating that. I mean, I know there's microplastics. I know we have toxins in the environment, but simple ones like if you're smoking, like that's just not gonna help your health. But I think most of us know that. But like alcohol is one of the interesting ones, because traditional medicine has always like tried to cut the balance of like there is some number of alcohol it's okay for you to drink, and we just keep driving that down lower and lower. In reality, any alcohol in you're ingesting is just increasing your risk of cardiovascular disease and cancers and stuff like that. The newest and the one that like is most interesting to me to see, though, is how important healthy social interactions is, that last pillar. So I'd say that's what Prime Health is. It's the simple things. It's one of the jokes they say when new longevity books come out is there anything new in this, or is this just do what your mother told you to do? Eat better, exercise more, and manage your stress. But like that really is Prime Health. And when you're doing that, then I say, then you can take it to the next level. We live in what is science fiction age, and there is really cool things that we can be doing in that regards. But if you're not focusing on that foundation and that Prime Health, then I think you're just kind of you got your pyramid upside down, I sort of say when I take my diagram.
Yeah, Dr. Goupil, that's very good, because if you look to achieve Prime Health, then you see a physician like yourself, and then you can go into the extended health span that they want. Like, you can have Prime Health today, but as I'm 55, what's my 65th year going to be like? What's my 75th year going to be like? Cane, crutches, wheelchair, hope to God nothing is like that. But Prime Health is fantastic, but can you extend that to a better lifestyle moving forward? So I
Yeah.
think you offer that for the patients that you see.
Absolutely. I mean, because I do. I mean, most of us, you and I, are probably going to easily live to be 100 years old. The question is, what
Quality.
are we going to be doing the things that we want to be doing in our 70s, in our 80s? And I think, I mean, we're going to be reaching that point where if you start early, like, but it's never too late. But like,
Correct.
we actually the crazy thing, because I'm into doing sprint triathlons and stuff like that. So I get a lot of things in my algorithms of these people doing crazy ultra marathons or Ironmans and stuff like that. And so I've gotten a lot of them recently where you're seeing like an 80-year-old that ran an Ironman, or like a 75-year-old that's just finished a marathon kind of thing. So I mean, again, my goal isn't that like every individual can do that. And I think we can make a strong argument for some of that exercise is actually pushing too far kind of thing. But it
Mhm.
is interesting to see, like we were talking about with business, to have that goal and say, no, look, like if this is what you want, this is something that can be done, but you've got to change what you're doing now if you want to be doing that in your 80s and your 70s, 80s, and 90s kind of thing. Because we all know all too well, I look back, I use my grandmother as an example, that she was just confined to like a chair in the house and a box of pills and stuff like that. And so I say, actually, in my last lifestyle medicine talk that I gave at the senior center, I said, we all know there's two paths of what we want our 70s and 80s, 90s to look like. And it's not me that's going to get you there. It's you. You deciding to be on that correct path, and then me helping you along that way, kind of thing.
Yeah, I love that. That's great. That had been very beneficial for them in that talk. Well, Dr. Goupil, I just want to say thank you very much for taking the time out of your day today to be a guest on our show. And I know that our listeners and viewers are going to take great advantage of the information that you shared, from your philosophy background, your science background, your medicine background, your advanced medicine background, going to lifestyle medicine. Just your tally and notches on your bedposts are getting longer and longer and longer every year. So I can see that you've got the drive to succeed. I always say at this point, if there's something that you heard, one little nugget that a friend, a colleague can benefit from what Dr. Goupil had to say, please do share it. It's important that we get the message out, that patient, or again, that clinician, physician can take their business, their life to the next level, and what we do with that. So I'll always say, of course, subscribe. But until next time, remember that true wellness is a journey we are all on together. Now, whether you're taking charge of your own health or guiding others in theirs, I just ask you to stay committed to your Prime Health journey. Again, Dr. Goupil, thank you very much for being a guest on the Prime Health podcast.
Dr. Barron, thank you so much for having me on. I really enjoyed this, and hopefully I'll get to see you again in the future and tell you how Extended Healthspans is going.
I look forward to that time too.
Take care.